Hello everyone. Welcome to Team TDF Wellbeing Webinar. My name is Irena Piotrowska and I am one of the practitioners at the Disability Foundation. I am an acupuncturist and today I'm going to show you how and where to press acupressure points when you start feeling unwell due to common cold or influenza. If there is someone that can help while we have this session, please ask for help. It's always nice, especially on the back, when somebody else does it for us. It is all accessible by ourselves, but just if you want to, if you have this opportunity, you can teach someone else. Acupressure can be done yourself or by someone else. It can be done on children as well. Please keep in mind that acupressure is a complementary medicine. If doubt, ask your GP. Remember, all of your videos and microphones are switched off. No one, including me, can see you or hear you. There is no live contact between us. TDF is a charity that relies on donations. Please give what you can. Now let's practice. Make yourself comfortable and minimize distractions like turning your phone into a silence mode. Mine is on silence mode. The guided part of this session will last about 20-25 minutes and include me talking you through a simple acupressure massage. Do close your eyes if you feel comfortable to do so. I will summarize what we have done at the end of the session. Please remember to pace yourself according to your own abilities. If you can reach point, it's fine. Just stay with us and learn. You can ask then some family member or anyone to help if you want to. You can stop and start at any point during the webinar. This session will end by 12:30. If you have any questions after the session or want to get in touch, please email us at therapysupport@tdf.org.uk. So now let's jump into practice. So remember, it's for first sight symptoms of feeling unwell. The cold changes in nature and it develops. So we are talking about the first onset. So the first point that we are going to learn today is Gall Bladder 20. It is located close to the base of the head. You can see they are symmetrical 2 points. On the nape of the neck, directly inferior to external occipital protuberance in the depression between the origins of sternocleidomastoid muscle and deltoid muscle. So try to first feel your skull where it ends. Then try to move your head and feel the depression between the muscles. And the other side. Like this. You can feel when you are in the right position, because you can feel the depression and that it is between your muscles. Now how you press it. You can press on both sides at the same time. 1, 2, 1, 2, 1, 2, 1, 2. Please continue to do so you can make like circular movement on that point. Try to feel your body. Sometimes, especially when I'm stressed or have worked too much on the computer, it feels tense when I press these points. It may not be the most pleasurable experience, but it will help you, and it's worth trying. It gets easier when you try it. Please continue doing so. So this is the first point that we try when we are having slightly sick, that something is, that we are coming down with something. It has many indications, from headache, cold, nasal congestion, facial spasm, and it helps release the tension on the shoulders and on the deltoid muscles. And sometimes this is the tension is cause of headache. So it's worth doing so, especially when you are sitting a lot and working stationary. So that's the first point. The second point that we are going to try today is called Do 14. So it's located more or less on the level with shoulders. It is located below 7th cervical vertebra, between 7th vertical vertebra and first thoracic vertebra. The way to find it, it should like stand out. Usually it stands out a bit when you bend your head. It's not the case with me, unfortunately. I can't show it on me. I had an accident and it's a bit different. But try to feel. You can check whether you are in the right position by rotating your head. This 7th vertebra will rotate. The next vertebra won't rotate with the movement of your head. So, and yes, it is located between vertebrae. Try to press it. I press it like, try to do the pressure you can apply to it and the way you can. You can use your fingernail if you want more, if you want more to use more pressure, to be more precise. Just find the space between vertebrae. It is good for common cold, for headache associated with common cold, cough, pneumonia, stiff neck, stiffness and pain of the back of the head, and nape. So as you see, it's just a couple of indications. There are much more. It's good for use in our everyday life. It helps release tension, like the point we previously used, Gall Bladder 20. Next point we are going to use is the point we know already. I mean, I mentioned that point when we had our previous webinar. So it's called large intestine 4. It is located on the dorsum of the hand between first and second metacarpal bone. Its location, try to feel the beginning and end of the second metacarpal bone. So it's located in the middle of that bone to the thumb side. And press this point like this. The other way to find it is to place your thumb like this when it bends on this bending line, press it between the metacarpal bones and just slide it. And we are at the large intestine 4. Press 1, 2, 1, 2, 1, 2, 1, 2, and do circular movements, or like linear along the meridian. It runs here. You can do this. So it runs here. Just press, lift, press, lift, press, lift. And the other hand, we can see there's mark. I am using that point every day, and unfortunately I had 2 long nails at one point, one day. So again, we find second metacarpal bone, and it's located in the middle of that bone on the radial side, on the side of the thumb. And we press it. The best way to press it is with a thumb, but it can get tired. So I'm just changing fingers. The thumb is the biggest one. So you know you are on the spot because you cover big area. So this point. So the point we just learned are 3 basic, most important one when you try to end the development of a cold. Gall bladder 20, do 14, and large intestine 4. Now, there are 2 points at the back. They are located here, bladder 12. Sorry, bladder 12, it's here. And it's symmetrical. And bladder 12 and bladder 13. Yeah, bladder 12 and bladder 13. So they are located between the scapula. So you can try to reach it doing this kind of massage. They are located, this is do 14, so one intercostal space between the vertebrae and the other space, and it's located on the level between second and third metacarpal bone, between first and second vertebra, I'm sorry. And the next one is located between third and fourth vertebra. Just massaging this part will kind of do the trick. There's bladder meridian located here. It has 4 branches. So, and it lies when you have your arms parallel to your body with this position of scapula. It lies next to the scapula, to the end of scapula, medial end, and there are 2 branches. And the second branch is in the middle from vertebra to the scapula ending. So just try to reach this location. If you can't do this yourself, please ask somebody else to help. It helps with the cold. It is good for breathing, for lungs, and it will make you feel better, less congested when you are coming down with something. There is the last part of helping yourself, self-help. So I call it is a face massage. I call it the ultimate makeup test. So what we are going to do, we are going to massage it like this under the cheekbone for 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the first part. The second part is massaging here above your eyebrow. 2, 3, 4, 5, 6, 7, 8. And the last part, you start from, let's call it the third eye, between your eyes or eyebrows. Just go up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you massage here, you massage here, and this way. So it's enough to do 10 repetitions on each area for children. I use it with my kid when she starts having runny nose and it stops development of cold. I didn't believe it, and once I haven't done it, and it was a mistake. So trust me, it works. It's tremendous how well it works. The old Chinese text says that we should massage, repeat the massage, the movement 100 times or 100 times. So as I am, from my experience, 10 times on kids is enough. And last time when I had trouble breathing, when I went to bed, when I had a cold, by the 30, I felt that my nose decongested. I didn't expect that, but it's what happened. So just find how much you need. For me, 30 was enough. 30 here, 30 here. And it does really miracles. So let's repeat what we've learned. We've learned that when we are coming down with something, a cold, we press Gall Bladder 20 at the back, between on the base of the skull, at the top of the nape, between sternocleidomastoidal muscle and trapezius muscle. You press this, then you press to 14, which lies between vertebra, between seventh cervical and first thoracic vertebra. It's located more or less on the level with shoulders. Everybody's different, so we need to take that into account. I can't tell you that it's precisely there. Then we've pressed large intestine 4, the famous point of acupuncture, and it's extremely well in acupressure as well. Then back exercise back massage, trying to reach below on the level of second thoracic vertebra and third thoracic vertebra. It will help us feel better. Plus, for runny nose, we learned this massage. And the other points to decongest runny nose, congested nose, or help with runny nose is around the nose. They are called local points. So first is large intestine 20. So when you smile, when you follow these nasolabial folds, follow it right to the sides of Alanasi. It's in the middle of this part of nose, more or less, and in the nasolabial groove. So this is large intestine 20. It decongests the nose. There is another point. You just slide up, and right under the bone on the side of nose. There is a point called B-tongue, and it helps decongesting as well. The last point is located here. It's yin tongue. It's called the third eye. It helps you relax and helps locally to decongest the nose. So what we went through just now, it's acupressure for first onset, first symptoms of having a cold. In Chinese medicine, this is interesting, there are two types of cold. Cold of cold nature and cold of warm nature. So what we went through is acupressure that works for cold of cold nature. So the cold type main manifestations are severe aversion to cold, and you can't get warm even when you are covered in bed and have long sleeves. Slight fever, because our pores in skin are closed. It's closed due to cold that we suffered, and headache. The difference between the warm type and the cold type takes years of studying, takes specialists to differentiate. But for the main differences is that when you are having a warm type of cold, you have slight aversion to cold, you do sweat, and you have sore throat. The other thing is that cold type can turn into the warm type. So as the illness progresses, it changes its nature. Yeah. First we have runny nose, then we may have sore throat, then a cough is coming. It changes and approach to these symptoms changes along. So what we learned today is for first onset, and these 3 points, Gall Bladder 20, do 14, it's here, do 14, and large intestine 4, they will help for either of types, whether it's cold type or warm type. The other thing is that often we suffer from headache when we are having a cold. So the point to help us with headache is called Tai Yang. It's an extra point. It means like B-tongue. It means that they don't lie on meridians. They are just points. There's no meridians that connects them to anything. So it lies between the end of eyebrow and outer canthus of the eye in the middle. When you feel it, there's this depression. Please try to feel, just slide your fingers like this, like if I had like Egyptian type makeup up. So it's located here. You may know this point from different area. In martial art, this point is considered fatal when blow is when you have, I'm sorry, it's fatal if you hit somebody here or if you are hit. So this is from martial art. So for headache that often associate having a cold, press Tai Yang. let's repeat what we learned today, because that's quite a lot. But I really want you to remember that, because it's very helpful. So we have gallbladder 20 between the sternocleidomastoid muscle and the trapezius muscle. There's 214, that lies between 7th cervical vertebra and 1st thoracic vertebra. There's large intestine 4, and symmetrically there are points on the back, on the bladder meridian. Let's try to activate this area. It will make you feel better when you do so. If somebody else does it, it is additional benefit for us, because it's just nice to have a nice massage, especially when it works. Plus, for runny nose, we've learned this massage like 10 times here, or as many times as you find you need. Like here, I find it work best when I lay down, usually before when I go to bed and I can't breathe, then I do this massage. So 10 times here, 10 times is minimum, 10 times here, and 10 times here. The other points that are good for decongestion of blocked nose are large intestine 20. It's located here. Yeah, when you smile, just follow the nasolabial folds that are created when you smile, and it's here. Then B-tongue, you slide it up the nose, right under the bone, symmetrically, and there is yin tongue. To alleviate headache, you press points called yin tongue. They are located symmetrically on both sides of the head, and you just massage them. Thank you to everyone who participated today, and please attend again. Please else tell your family and friends. If possible, and if you liked the session, please support the charity's work. If you have any questions after the session or want to get in touch, email us at therapy support@tdf.org.uk. Thank you very much for attending. I hope it was helpful, and please continue massaging yourself. See you next time.